Okay, everybody, how about we get started? Welcome to our May 26th update. Many of you schools are out or already or are getting out, and congratulations for surviving the year. We have a few new things to talk about today, and we'll click on this. We'll do announcements as usual, COVID data update, and then we have a guest speaker for immunization information. We'll talk about some resources and then get some questions. So announcements, the first thing is that we won't be having an update next week. We're going to take a week off before summer school starts up. We will continue at the same weekday and time with reminders and an agenda, and then follow up with the email, same as we've been doing. We're going to evaluate the need over the summer break and see how many people participate. If there are pressing issues that we need to talk about, we'll put out some information about that and then have a meeting. We may consider having fewer calls or maybe just having some email updates that we send out. So for now, for sure, that should say 6:21. Sorry, I put 7 at 11 in the morning. That's the next. Oh no, I'm sorry. That's when we're going to start back up for fall. Sorry. So that is this July 21st. Smarter than I gave myself credit for. And we'll send out an email early in that week. So if you're going off on summer break, that's when we're going to be starting back. And it looks like that's when the schools are all going to be starting back. So we'll do that. I wanted to put in a copy of the sanitary measure. It came out just right after we had our last meeting. The important part is that the sanitary measure is hereby rescinded, but here's a copy of it in case you hadn't seen it. And for COVID update, we're still at a low community level, 16.09% test positivity, which is higher in the last 7 days. We went up a 0.2 for vaccinated on each of the percentages. Seems like we do about 0.2 per week, so that's kind of interesting. But we're making progress, so that's important. The other thing I wanted to add this time, Matt Christenberry, you all know his name from doing the COVID epidemiology from the health department. He suggested that we use this information to kind of outline how much of a jump we've made. So as of May 18th, the COVID risk is still low. And you know that this can be low, medium, or high based on the CDC's community level metrics. So you can look on the webpage for what the metrics mean, but it's a combination of information. The image here shows that we are seeing an increase in our COVID-19 new case rates, jumping from 74 cases per 100,000 on May 11th to 104 cases on May 18th. So it's something that everybody's keeping an eye on. We're not pending going any higher on our level right this minute, but stay tuned. So we'll see how it's going to go. And then I put this in to just be another one that everybody is used to seeing. Case rate per 100,000 is 104.8 or 0.08. And then there's admissions and inpatient beds, but that hasn't changed a whole lot. Okay, and then we're going on to Kristen Robinson Lund is our guest speaker today. She is the North Clinic nurse manager for the health department, and I'm very grateful that she could be with us. Here's her first slide. Kristen, take it away.
Great, thanks, Connie, for having me. Just some reminders. So we talked a little bit last time about some of the data coming out from Arizona Department of Health Services. And that was based on some of the IDR data that they put together. And it is showing that we're having some mild decreases in childcare and 6th grade coverage rates. So, so we just want to make sure that we're addressing some of those in the school settings if we can. In kindergarten, they're seeing a moderate decrease in coverage and an increase in exemptions. So we do encourage, if parents are have questions about exemptions, or they're wanting to just use exemptions because they can't get into the doctor's office, those kinds of things, that we provide education to those families about the importance of getting the vaccinations taken care of, and refer them to the locations where they can get those. So all of our health department clinics are open throughout the summer, and we do ramp up our coverage of those clinics to address back to school needs. We recognize that families have a hard time getting into their primary care providers sometimes over the summer. And so there are alternative places for them to go to get vaccinations. So please encourage that. And did we have one more slide, Connie? Okay. This one here. Okay. So just as a reminder, our 3 clinics are located at Broadway and Kolb, Midvale and Valencia, and First and Prince. Our services are provided to insured patients as well as uninsured. So for families who are unable to get into their primary care physician's offices, we can still we can bill for those vaccines through their insurance plans. And then if they are uninsured, we have Vaccines for Children program funding from the CDC through the state that covers those services without fees. So there's no fees for those immunizations for children. Our clinics also provide COVID vaccinations, and we do provide regular adult and childhood immunizations in the clinics. So adults can come see us as well. We have a vaccine for adult program that are vaccines that are available to adults that are uninsured as well. So if schools are looking to hire people that don't have insurance yet and they're needing like a Tdap or an MMR to get hired on, we can provide those at our clinics as well. Okay, and the next slide. So these are some of the resources that you can look at to look at some of the data for community levels. The school support at pima.gov. Connie, this is the email that we're asking people to utilize if they are looking for an immunization event at their school throughout the school year or over the summer. We are currently trying to organize those and coordinate those. So if you have those requests, you can submit that through the school support team. The public health nurses at the clinics are working together with our vaccine equity team to provide services as immunization services, as well as other services, maybe at resource fairs. So we can look at coordinating those services at an event for you. Pima County Health Department has contracted in the past, and you're all probably pretty familiar with PMG, who did a lot of COVID clinics in the community. And they are also going to be providing some vaccinations as well in and offering some services to schools. But that hasn't been totally ironed out yet, what that's going to look like. And so we're going to wait for them to get more details to us before we provide that information. And so I'm happy to take any questions if anybody has questions. Okay, great. Well, thank you guys so much for having me on today.
There's one question from Kathy. It says, has the ADHS study using brief info videos prior to providing an exemption from form shown any results, and how many schools are participating? Does it make any difference in numbers of exemptions?
Oh, good question, Kathy, and it's nice to hear from you. I do not have the data for the videos, but we can certainly get back with the group and provide that information at a later time.
Yeah, this is Kathy. What I was asking was, I know we have a lot of schools. I know TOSD has been using it for a while. I don't know whether all the privates and parochials, or whether can anybody access that, and when does it get out of like pilot status so that people can utilize this tool? Because at least we know parents are getting some information before they're just saying, give me an exemption form.
Right, exactly. I will get back to you with all that information, and that's a great idea that we could share those resources so that if parents do have some hesitation, the schools would have something that they could direct them to get further information and education. I think that's a great idea.
Thanks.
Anybody else have any questions for Kristen? Okay, thank you. There is one question in the chat. Do you expect us to go to medium community level based on the increase of positivity? In communicating with Matt this morning, he did not say that that was a pending decision, but we don't know. So basically, I think what we have to say is we don't know at this time if that's going to happen. But that's why we need everybody to stay tuned. Any other questions? Okay, well, it sounds like everybody's ready for a break. I know that a lot of you are working over the summer, so we'll be in touch and hopefully we can have an easy summer with summer school and be ready for the fall. Thank you all for tuning in. Take care.